day, friends of Buzzy. So happy Friday to all of you guys. Today on the Buzzy Helps Pain Management COVID News Hour, which is really just 15 minutes. First of all, I'm going to tell you about a new pain partner. I'm going to talk about a really great resource for information and science around making your own mask. I am probably going to change this one up for something, so you'll want to stay tuned for that. I'm going to also talk about some new information that dropped last night about incidence and differing characteristics of 14,000 patients that were admitted with COVID to New York or in the UK, and talk a little bit about what we're learning about risk factors that's somewhat different from what the Mexico study had. And finally, I will finish up by talking about my favorite updates on nasal irrigation for preventing and decreasing the severity of COVID. So to start out, as you all know, where this got started was we make devices for pain management. So if you hurt, we have a specific frequency of vibration that goes into a little pouch that you can then put on your elbow, so when you've got tennis elbow or after surgery, activate the vibration and decrease pain. And it comes with different options. You can either use ice packs, our VibraCool Flex has heat packs. I tell you all of this because one of our pain partners today has the cool opportunity of being put with our other VibraCool products. So we started when COVID kept people inside. We started by adding to our VibraCool package pain care implements, so it could be a pain care package. So we've got 50 different ways to decrease pain at home. We've got a little secret chamber that has a whole bunch of bonus stuff. And so today's bonus stuff is Neptune Ice. Now, the thing I love about having an additional multimodal opportunity with a topical anesthetic is that this one actually has 4 anesthetics. So it's got lidocaine, which blocks the sodium channel so the pain can't get transmitted. It's got menthol, which actually stimulates one of the mechanoreceptors. It's like a little light touch tingly thing. So that's 2 different mechanisms for decreasing pain. And the way that I would use it with a VibraCool, we're working on getting some pain care pads, some pain liners. But for right now, if you have in your household some panty liners, like really thin ones, you could put this on and use the vibration and the Neptune Ice at the same time. So we'll be giving a free sample of this with our VibraCool for everyone that gets sent out until we sell out. And the only thing I would say about using menthol with this is you don't want to use our ice packs at the same time. So there is a potential synergy of getting it too cold using ice packs with the menthol. So that's the only thing. If you're going to be doing it with the ice packs, don't use the menthol simultaneously. And if you're going to put menthol on, even though you can wash the VibraCool in the regular washing machine, use a panty liner. Until we get our stuff together, use a panty liner when you're putting it on so that you're getting 4 different pain relievers at once. All right, so thank you so much, Neptune Ice. You guys are awesome. Really appreciate what you do. So as you know, I have been a proponent since sometime in early March of mask wearing. And there was all of this feedback about how, oh, it's not as good as N95 and it's not as good as surgical masks, and so don't steer people wrong. Well, the reality is that as of yesterday, Delta, American Airlines, and some other, probably United, who knows, but they joined JetBlue in requiring that customers who go on planes use masks. So there's another study that came out yesterday from China that looked in Wuhan at aerosolized levels of the virus that are still in the air. And what they found was, indeed, there are still COVID or SARS-CoV-2 virus particles that are in the air. They're particularly in bathrooms and in places where there is no cross ventilation. So what does this mean? Well, first thing is, it means that you really need to be aggressive about wearing a mask. Dear Mike Pence, it's not about everybody else around you and you testing negative. It's about you too, because the whole thing is, if you're in a hospital where there is no open window cross ventilation, then if they have any COVID at all, those particles are still circulating in the air. There's a case in China where 3 people who were next door at a table at a restaurant got the virus, and it was from this person here who wasn't even symptomatic yet. It got circulated in the air conditioning and went to that person. So the whole point about wearing a mask is not just what if you have it and you sneeze. It is definitely about protecting you. So this was the cool thing. So there is a website that I will put up that has looked at all of they actually just made cool graphs based on data that was previously accumulated. And so the interesting thing about this graph is that it looks at the ability of different substances to stop COVID. So, surgical mask stops 89% of it. Vacuum cleaner bag, because those are hot, that stops 86%. And dish towel, cotton blend. So the 2 that they liked best overall are an antimicrobial pillowcase or making your mask out of a cotton poly blend t-shirt. So when I make my next set of masks, instead of a single fiber polyester, I guess 2-layer thing, I'm going to go for a cotton poly mask. And the reason that they preferred this, even though things like vacuum cleaner bags were actually better at stopping the particles, was breathability. The fact that you can make something out of a t-shirt, and particularly a 2-ply t-shirt that is easy to breathe through, is really worth it. I still think that my design of having little ear holes and making it look a little like a Dumbo, I still think that's the way to go because it's so much easier. Put it on and take it off. But at least now you know pillowcase or t-shirt are the things to destroy in your house. And not a cotton t-shirt, not a 100% cotton poly. Probably the reason for that is there was a different study that looked at cloth masks that found that the older they were and the more they got washed, the more porous they became. So probably the thing that is good about a cotton poly shirt is that it's less likely to stretch over time. All right, so that's interesting and cool. Looking at risk factors for who is considered to be at risk. So in numerous places, the number of cases of reported COVID yesterday went up 23%. Mortality, no new death cases, went up 29%. We have a lot of places all over the country that are opening up, and everyone's saying protect yourself if you're vulnerable, but they're not doing a really good job of saying who's vulnerable. So we've talked before about how obesity is related to this, and I think that an important factor is that that different countries have different levels of obesity, and so if you are in China where the level of obesity or the prevalence is 4%, you're not going to see obesity come up on their list of danger signs because there simply aren't those patients there. So the number is going to be very impacted by what we call a pre-test probability. You know, before you even start, how big is your pool that you're drawing from? So the interesting differences between what the study in Mexico found and what both the study in the UK and in New York found is that in Mexico, first of all, pregnancy was a high risk factor. It was not in either of the other two studies. So that's fantastic. To know that being pregnant is not a big risk factor in groups that look like most of the places in the US, that's fantastic. So that was, I thought, a really good news. The interesting thing about the US, and these are the cases from New York, so the largest pre-existing condition for admission to hospitals in New York was hypertension, followed by obesity, followed by diabetes. In the UK, where only about 26% of the population is obese compared to in the US where it's 36%. So in the UK, highest comorbidity was about 30% was cardiovascular disease, then diabetes, then emphysema, COPD, chronic obstructive pulmonary disease, but not asthma, then renal issues, and then asthma. They actually, while they reported that obesity was an issue, they didn't put it as its own separate thing, so it's hard to know where in that spectrum it was. But they did say that having obesity plus any of the others made it much worse. So, and so interestingly, in China, the biggest cohort that they had, cardiovascular disease was by far the most, followed by diabetes, followed by respiratory, and followed by hypertension. So there is some kind of consistency, but I think that when you're looking at these different things, it's a good idea to look at the population that's closest to what yours is. So now we're talking in the US, I think the New York data is probably the best. The other thing I got a question last time about, so I'm 50, where does that put me, since the Mexico stuff said that 40 and younger was highly protective, and 65 and older is worse. So what is it with 50? The new study that came out yesterday gave a very explicit, between 50 and 65 was, those who got it, it was a 1.6% mortality. So there is an increased risk for 50 to 65, not nearly as big as the 65 and up, and not nearly as protective as 40 and under. So at least finally somebody gave us 50-year-olds our own specific category to worry about. Well, anyway, I think that the biggest part of the debate about, whether to open up is that if you are opening up without keeping the people who are vulnerable, knowing who they are and keeping them inside and helping them get money, helping them get groceries, and giving them a subsidy so that they don't have to work, if you're not doing that, then you are absolutely jeopardizing every single emergency doctor who is out there bravely fighting this disease with no protective equipment. I was just on a call with a hospital, and we're hoping to do a study looking at the nasal irrigation that I talk about. And one of the criteria for doing the study is that in no place in this study could we use any additional protective equipment. So if there was any personal protective equipment extra that had to be used, giving people the nasal rinse, or enrolling people, or talking to them about being in the study, or demonstrating what needed to happen, if anybody had to do that in person and put on an extra gown, even one, it wasn't considered ethical to do it. That's how bad it is. That is how dramatic the shortage is on personal protective equipment. One of the people who works for me, who's actually been bringing in PPE because he's got connections in China where he can get it, he said that apparently France bought 2 billion gowns in March. And so one of the reasons why the masks are gone is because of the Australian wildfires, and France was proactive and bought 2 million gowns. So the people who are at risk are the people who are on the front lines, and that's the worst part of opening up early. But the second part of opening up early is, I think that we're starting to also acknowledge that distance and density matter. So if your city has at most 50 people per kilometer, that's a really low density. Sweden has about 25, so a lot of and New York has like 413. So the density of your city is something to consider. But also, if you consider the new information about the aerosolized particles still being in the bathrooms in Wuhan, you've got to realize that if you're out jogging, you are spraying a glitter bomb of COVID virus all around you as you exhale deeply. And if it's not a windy day, that stuff's kind of floating and hanging. So everybody needs to be wearing masks. And if you have any of the risk factors we talk about, stay inside. And if you're a policymaker, figure out a way to get them money so they can stay inside. Because if everybody else wants to go outside, we have to do something for these people who are at high risk of overwhelming our emergency rooms. Keep them inside. All right, so that's very exciting. I wanted to share something. So somebody had a question, and I hadn't realized that, as a doctor for so long, that this might be something that was confusing. So the nose is only separated just a little bit of the way up, and after that, it's all one big cavity. So if you wanted to do a magic trick, you could put a string up and have it come down and go, no, I wouldn't do that. That would hurt a lot. Very delicate tissues. But the whole thing about how doing nasal irrigation doesn't cause you to feel like you're being waterboarded or have any problems breathing. So what you're actually doing is going up one schnoz, and as it fills up, once it gets past the septum, which is that little piece of flesh in between the two sides, it just goes straight out the other side. It's just like there's one little packet in there. There's one container, there's one chamber. So that's why it can go up one side and out the other very easily. All right, well, with that lovely graphic fun fact about how this is why you can snort water or milk when it comes up the back and it comes out both sides. It's all one little reservoir of stuff to snort when you have a sudden joke. So does anybody have any questions for me? And thank you all for your kind comments for watching. I was on the Outcomes Rocket with Saul Marquez this morning, and he is a delight and such a good healthcare outcomes interviewer. So we will post that link so you can hear more. And until next time, which will be defined as Monday, everybody assess your risk, assess your family's risk, make them realize this is not a hoax. This thing is absolutely a serious, scary deal. But if you know your risks, and if we just wait for a few of these great studies to get finished, I will talk about vaccines on Monday. There's some excitement, some possibility, probably by January, but it's going to be